And so now let's begin with our presentation. Joining us today, we have a team from California Immigrant Policy Center who will be providing us with some updates. I will now be handing it over to Carlos Alarcon, who will lead us right into the presentation and introducing the team. Thank you, folks, for joining us today.
Cool. Awesome. Thank you so much, Catherine. Thank you, everybody, for being here this morning. My name is Carlos Alarcon. I am a health policy analyst here at the California Immigrant Policy Center, and we're very excited to provide an update on different immigrant policies that are happening here in California and that CIPC is leading. I'm here joined by my colleagues Benjamin and Daniela, and they'll be able to introduce themselves later on in the presentation. But welcome. We can go ahead and get started with the next slide. So, like I said earlier, we are the California Immigrant Policy Center, and we are one of the state's leading immigrant rights organizations. We are based both in LA and in Sacramento. And what we do here is that we advocate for policies that uphold the humanity of immigrants and refugees while advancing racial, social, and economic justice in California. Next slide, please. So in this slide, we're able to see kind of who is a Californian really, right? So who do we represent and how do immigrants and undocumented immigrants specifically impact California? So around 2.3 million undocumented Californians live in our state currently. They make up about 1 out of every 10 workers, and they contribute about $182 billion a year to the state of California. So what we can see here is that undocumented Californians, they are a critical part of not just our economy, but also who we are as a state. But we still remain locked out of a lot of safety net programs. I say we because I'm undocumented myself. But yeah, this is sort of why we do the work that we do here at CIPC. And then we can go on to the next slide and I can go ahead. Oh, here we go. Thank you. And starting off, we will be talking about our Health for All campaign that CIPC co-chairs and has been co-chairing for over a decade. So next slide. So really the journey and the start of the Health for All campaign began around 2010, back when the Obama administration signed the Affordable Care Act, which was able to expand healthcare coverage to millions of people throughout the country via exchanges and Medicaid expansions. Here in California, they developed the Covered California Healthcare Exchange. However, this expansion explicitly excluded undocumented immigrants from the exchange and from the Medicaid expansions. Medicaid here in California, we call it Medi-Cal. So they were explicitly excluded from both Covered California and Medi-Cal. And because of this, a lot of different immigrant and health rights organizations kind of came together to form the Health for All Coalition in 2013 out of the need and the moment to remove healthcare exclusions to undocumented immigrants, specifically trying to expand healthcare access in the state of California, regardless of anybody's immigration status, right? Diseases and injuries don't discriminate based on immigration status, so why should our healthcare system, right? So this coalition is a community-facing one and a community-driven coalition. There's a we have a coalition of over 100 different organizations throughout the state advocating at different levels, anywhere from in Sacramento to the local level, or just peer-to-peer grassroots educating folks on the resources that are out there and the benefits that people qualify for, right? So this was kind of the inception of the Health for All Coalition. And if we go on to the next slide, we are able to see that this has been a long fight, right? In 2024, beginning this year, California became the first state in the nation to expand its Medi-Cal program to all residents, regardless of immigration status. But that came in increments, right? So the Health for All Coalition, we were able to get Medi-Cal expanded to kids ages from newborn to 18 in 2016, young adults 19 to 25 in 2020, older adults 55 and up in 2021, and starting in 2024, January of this year, the final age group, the 26 to 49 year olds, undocumented Californians, were finally able to get Medi-Cal. And this is huge, right? We're the first state in the nation to do so. And this was a result of years and years of advocacy from community members. And also, just want to add, Medi-Cal is not considered part of the public charge test. Medi-Cal is a state-funded program. I know that some of y'all might know that, but just it never hurts to repeat it at any chance we get, because we know what public charge kind of did to our communities, kind of stowed a bit of fear. So we just wanted to reiterate that it's not public charge. Additionally, some of the work that we are doing here at CIPC to make sure as many people, one, know about this expansion, and two, get enrolled in this in Medi-Cal, is that we have been able to provide different organizations throughout the state of California, anywhere from San Diego all the way to Humboldt, grants to help with outreach, education, and enrollment to undocumented communities, specifically for Medi-Cal and any other public benefits. So that's some of the work that we are doing, have been doing around the recent Medi-Cal expansion. And then moving on to the next slide. I mentioned earlier, right, in 2010, both Medi-Cal and Covered California had exclusions for undocumented Californians, right? So now that we finally got the victory in terms of Health for All Medi-Cal, we are now switching and pivoting to Health for All Covered California. So the reason why we're doing this is because if a lawfully present Californian has income just above the Medi-Cal limit, they can turn to Covered California, which is the state's online health insurance marketplace, right? We don't think it's just that if an individual makes slightly above the Medi-Cal limit, they don't qualify for Medi-Cal, but also because of their immigration status, they also do not qualify for Covered California, right? So we've been working with different partners like the UC Berkeley Labor Center to figure out exactly what the impact is of this Covered California exclusion. And what we figured out is that over 600,000 undocumented Californians would benefit from a Covered California expansion. These are individuals who are uninsured, either because one, they don't qualify for Medi-Cal, two, their employer doesn't provide health care, and three, the private health insurance market is just too pricey for them, right? So around 600,000 undocumented Californians fall into this category. And what we at CIPC and the Health for All Coalition are trying to do is we're trying to push a policy that will aim to create a state-funded mirrored healthcare exchange. So what that means is a healthcare exchange that mirrors Covered California, offers as close to identical plans as those offered in Covered California as possible. But in this healthcare exchange, undocumented Californians would be able to shop and compare different plans. So that is what we're doing with AB 4, which is Assembly Bill 4, which is being championed by our legislative ally, Dr. Joaquin Arambula. This is a fight that is going to take multiple years to get based on where we're at here at the state. But this is something that, again, over the over 100 organizations within the Health for All Coalition are pushing for, and we are very, very excited to do that. So, sorry, maintenance are going by. But this is something that won't be unique to California. Other states have done similar things before, but those other states don't have the proportion of undocumented people that California has. So it's going to be a little bit difficult, but we are looking at these other states to see what the best lessons learned from them. And next slide. And yeah, and here I wanted to provide you all with a wonderful, wonderful resource. It's the Health for All Resource Roundup. We're calling it the Resource Hub, but it's basically a document that has resources with information all about the Medi-Cal expansion, public charge, Medi-Cal redetermination in sometimes over 19 languages, right? So what we did here is that we met one-on-one with all of our Health for All partners, in which a lot of them are direct service providers. We were like, do you have any resources that you would like to include in this resource hub that gets disseminated around to the rest of the coalition? So we have a good amount of resources there that are being used for not only by our Health for All coalition partners, but also our Health for All grantees. Yes, so the link to this resource will be shared out, and additionally, I believe hopefully the slides will be shared out as well, but I can always follow up to make sure that y'all get it. Additionally, CIPC, we are in the process of turning this resource hub document into a website. So it won't be like on a document, it'll be on an official website that y'all can visit and share amongst yourselves, amongst your colleagues, and amongst your other organizations that you work with. But this resource roundup, as it says here, it has webinars, flyers, slides, social media graphics in multiple languages, talking about the Medi-Cal expansion, who is eligible, what kind of benefits individuals would be able to qualify for. So very excited to share this with you all, and I'll make sure to keep y'all and First Five updated once we're able to get the website up and running. But yeah, that's just some of the things that are brewing up here in California in terms of health policies. And if y'all would like to stay updated with the work that we're doing in the Health for All coalition, please feel free to reach out to me. My email is right there. Or if you would like to ask questions or add some of the resources that you might have onto the resource hub, please let me know as well. But yeah, to that, I just wanted to ask if anybody had any quick questions. We will also be doing a Q&A later on as well. Cool. Awesome. So with that, I want to thank you all, and I'll go ahead and pass it over to my colleague, Ben.
Hi, thank you so much, Carlos. So similar to Health for All, I'll be presenting on a campaign called Food for All. Next slide. And before I talk about our campaign, I just wanted to share more context about why we are leading the Food for All campaign. And the reason is that we know anecdotally from community experiences and from the data available that undocumented immigrants in California are experiencing severely high rates of food insecurity, and compared to the general population, experiencing a disparity there. We know that 45% of undocumented Californians are currently experiencing food insecurity. And when we look at families with children in particular, that rate is 64%. So that means that nearly 2 out of every 3 undocumented children are affected by food insecurity. And if you are interested in learning more about this, this information is on a report that lives on the CIPC website. Next slide. Also, besides food insecurity, one other measure we can look at is the poverty rate. And this is more recent research, but we found that 41% of undocumented children and young adults who are below the age of 26 are living in poverty. And compared to the statewide average, that is more than twice the rate. So this is really alarming, and the impact of this on the undocumented population is can't be ignored. We know that families that live in poverty, children that live in poverty, are more likely to develop emotional disorders and cognitive disorders as a result of toxic stress. There's a higher risk of chronic illness, lower quality of healthcare, higher exposure to environmental pollutants because of where these families are able to afford to live. And this also impacts people's ability to pursue and achieve education, which could have, cascading effects into adulthood. So this is why we're leading Food for All, which aims to expand food benefits for immigrant Californians. Next slide. The program that we're looking at to change is our food assistance program. In California, it's called CalFresh. CalFresh gives families an EBT card, which allows them to buy food at the grocery store. And it has a lot of beneficial effects besides being able to afford food, because it frees up that household's income to pay for other necessities, including rent or clothing or paying for their education. And when families enroll in CalFresh, they see numerous benefits, including improved health. And also when families use that money at a grocery store, it helps their local economy because they're able to stimulate the economy by spending their CalFresh benefits. Next slide. However, because CalFresh is a federally funded program, it's subject to federal exclusions, which, similar to Medi-Cal, exclude undocumented Californians. It also includes DACA recipients, and CPS holders. But one thing I want to note here, and especially for folks who do a lot of communication with immigrant communities, is that in mixed status families, if there are family members who are eligible for CalFresh, but perhaps the parents are excluded because of their status, we encourage folks to look into applying for CalFresh because the entire household doesn't need to be eligible. And so if there are benefits available, we know that that goes a long way. But for the time being, CalFresh excludes undocumented immigrants, and Food for All campaign is seeking to do that, to change that. Next slide. So Food for All launched our campaign in 2021, and in 2022, we won our first commitment from the state of California to expand food benefits to undocumented Californians. The way we would do this is through a state-funded program called the California Food Assistance Program. And what we won was a commitment to expand the California Food Assistance Program to everyone ages 55 and older. And last year, it was announced that this would be implemented in October of 2025. So that's when benefits would begin being available to undocumented Californians age 55 and older. But actually, last month, we heard a proposal from the governor to delay the implementation of this Food for All expansion. And this delay would be 2 years, pushing it back to the end of 2027. So that is where we are in the middle of the advocacy. The budget, which is where this will be decided, is supposed to be signed this month. And so we're in the last month of pushing for Food for All. And our message is to not delay this expansion. The reason is, we would prefer this expansion to happen immediately, but it takes time to roll out and work with the counties. But we want to stick to the original plan because we want this benefit to be available to families as soon as possible. Another part of our advocacy is that we want, when this older adult expansion was implemented, we want the state to include all age groups as well. So that is also the bottom line message for Food for All is to have this implemented as soon as possible and to not discriminate on the basis of age. Next slide. So yeah, this is our Food for All coalition, which has been crucial in making our progress possible. This is a picture of us rallying outside of the Capitol with coalition members and our legislators. We have 2 bills AB 311 and SB 245, authored by Assemblymember Santiago and Senator Hurtado, who have been leading with us on Food for All since 2021. And we're trying to raise awareness around this issue. And this is a story we had featured about Food for All in the Sacramento Bee with our partners, showcasing how winning Food for All will also improve the health of Latinx children. Next slide. Are there any questions in the chat? No, okay, so in that case, which U visa holders are excluded, Fatima? So I don't know off the top of my head, but I will look it up and I will reply in the chat. But that's a really good question, and I don't want to misinform you.
Hi, everybody. My name is Daniela, and I will be presenting. I am the Economic Justice Policy Analyst at CIPC. My team focuses specifically on economic justice related issues and undocumented communities. So topics around workforce development, making sure that people who are undocumented have access to high quality jobs, ensuring that the gaps in the safety net related to economic issues are also met. And one of the big campaigns that we have been working on for the past couple of years has been Safety Net for All. As my colleagues Ben and Carlos mentioned, California has made tremendous strides in terms of Medi-Cal, access to health benefits, access to food. However, we're currently still facing a really big gap when it comes to providing people with the financial resources they need when they lose their jobs. So one of the priority campaigns that we have is the Safety Net for All. We started back in 2020 when COVID hit. Over the past couple of years, we have built up a membership of over 120 organizations. I believe that number is over 150 now, almost close to 200. But the goal has been to extend unemployment benefits to excluded immigrant workers. So as of now, people who are undocumented don't qualify for unemployment benefits due to federal restrictions, similar to how people in the past were excluded from healthcare benefits, from food benefits due to federal restrictions as well. So we know that undocumented communities, we've talked about it throughout this presentation, are an integral part of our communities. 20% of all Californians live with someone who is undocumented or are undocumented themselves, right? We also know that when people lose their jobs, unemployment insurance has helped people weather some of their biggest economic challenges, right? We had the COVID-19 pandemic that provided disaster unemployment insurance that really got people through tough times. And we also know that job loss can occur at any time, right? A factory shuts down, people are laid off, and the resource that they rely on is unemployment. However, for many of our undocumented workers, that's not an option. One of the biggest things that we saw, for example, in the floods of early last year in Planada, for example, the majority of the community there was completely devastated due to the floods, lost their homes, crops were destroyed, didn't have a job, and also didn't have a safety net in terms of financial resources to rely on because of their immigration status. And we know that Californians who are undocumented contribute annually to the state, not just in financial ways like we've mentioned, but it is important to note that employers do pay close to $302 million to the unemployment insurance system on behalf of the labor of undocumented workers, yet these workers never see any of that money back. They never see any of their contributions because of these federal restrictions. So as a statewide policy organization, part of our role is to see this is a problem that exists. This is a problem that impacts our undocumented community members. How do we think creatively about bridging those gaps? And this campaign is one of the ways that we're trying to address that gap in the safety net by extending unemployment benefits to those workers. As of now, we have a current bill. The original ask was to provide $300 for up to 20 weeks to folks that are undocumented when they lose their jobs. If any of you, or perhaps several of you, are staying on track of just budget conversations in the state of California, we are in a budget deficit. The number has varied throughout the year. I think right now it's like 68 billion maybe that's being split into a deficit this year and then going into like the deficit planning for next year. But we are in a moment in California's history. It's not the first time it's happened, but there are cuts being made left and right to social safety net programs across the board. And one of the things that we're seeing is that existing programs are currently being impacted, right? We see the delay of Food for All expansion, but we've also seen cuts to other important programs like IHSS for undocumented workers. That program has been proposed to be cut as well as funding for legal services for undocumented workers. So what this means is right now, California really is prioritizing existing programs and not necessarily investing or putting in money into new proposals or changes to the current system as is. So one of the things, so understanding just kind of where we are, part of the switch of the campaign has been to really lay out the foundation for how we build this program up in the incoming years, as the change that is needed for this program to exist is incremental. So right now, one of the things that we're working on is ensuring that elements of an excluded worker program that would provide unemployment benefits to undocumented workers are included in current efforts to modernize the Employment Development Department, EDD, to ensure that they're in the conversations that they're having around improving EDD. If anyone here has filed for unemployment, I myself have, knows how much of a hot mess it can be or how difficult it is to access. So there are ongoing efforts to just improve it overall. And we want to ensure that in those conversations, in those developments, undocumented immigrant workers are included, so that this program is something that could exist years down the line. As of now, the campaign is kind of at a standstill. Standstill isn't the right way to put it, but right now we're thinking strategically around what the best next steps are. If folks are interested in getting involved, you can go ahead and sign up. There's a bit.ly here where you can sign up to stay involved in the campaign. And if you have any other questions, there are programs that undocumented workers do qualify for, like paid family leave or state disability, because they're state funded programs. However, we at CIPC don't work as closely with those because those already exist. However, we can connect you with other organizations that are leading some of the efforts around that, to ensure that if there are community members that you're working with that have a question around SDI, state disability insurance, or paid family leave and are undocumented, we can go ahead and connect you as well and share any resources that we may have. And I'd like to thank you for taking the time to listen and learn more about our campaign. We have other campaigns that we're also working on, but for this group specifically, we thought that these were kind of the overarching campaigns that might be most relevant to the work that you do. But we're always happy to answer questions or engage in thought partnership with you all. The way that we also develop policy is listening to partners. So if there are things that as service providers you're seeing on the ground with the community members that you're working with, we'd love to know, right? Because then we can engage in thought partnership around, hey, there might be a solution to this, or hey, this program actually exists, and we can always connect with you all to ensure that you have the resources you need, and we're able to be there to provide that information as well. So thank you for your time. I will pass it back to Catherine or Leah, and also open to any questions that people may have.
Yes, thank you, Daniela. I'm going to take this time to open it up to the floor, to open up to those who would like to present some questions. You're welcome to come off mute. You're also welcome to add your questions onto the chat to see if there's anyone that also would like to use the chat to share some questions.
Maria?
Hi, I'm sorry. I think I'm a little confused. Did you mention that the unemployment benefits for excluded immigrants is still a pilot project?
It's a campaign that we're still working on. So it doesn't exist yet.
Doesn't exist.
Yeah, we're pushing for the governor, for the state to make this a priority, because we know that our communities need it. But where we are in this campaign is very similar to maybe where Health for All was back in 2016. So we're kind of in those beginning stages.
Okay, so undocumented people cannot receive unemployment now, right?
Excluded undocumented workers, yes. So people who have DACA, for example, do qualify. Certain people, there are eligible immigrants that do qualify for unemployment insurance, but if you don't have any status, for example, like I have a family member who doesn't have DACA, isn't identified as what they call like an eligible non-citizen, those folks do not get unemployment insurance. So you lose your job, that's it, right? Like you don't have anywhere to go to ask for support or get the resources that you need.
Thank you very much.
And of course, thank you for your question.
Opening up the floor to anyone else. You're welcome to come off mute.
Just wanted to go off mute to go back to Fatima's question about U visa holders and whether they qualify for CalFresh food benefits. If you are a U visa applicant, you also qualify for CalFresh benefits in the state of California. So I've linked the link there, and the resource that Daniela shared doesn't include some specific qualifying immigrant categories in California. So I'm also going to link a very thorough breakdown of immigrant eligibility for CalFresh. But if folks have any specific statuses that they are curious about, feel free to ask or email me.
All right, other folks. Thank you for that, Ben. You're welcome to come off mute, see if there's anyone else who would have some questions.
I have another question.
Sure.
This time for Carlos. I was confused about the medical benefits for undocumented immigrants. Is that the full scope medical or just emergency medical?
It's full scope Medi-Cal. So before the Medi-Cal expansions, and before this latest one in January, immigrants would only qualify for emergency Medi-Cal, right? But starting January of this year, full scope Medi-Cal is offered to any Californian, regardless of immigration status or age, as long as they meet the income eligibility.
Thank you.
Thank you for the question. Thank you, Carlos. Anyone else that had any other questions they would like to share? And anyone in the chat? Let's see if there's anyone in the chat that had any questions. Okay. Well, I guess we could wrap it up if there's no other questions. I just want to first thank Carlos, Daniela, and Ben, California Immigrant Policy Center, for presenting us with these updates and for being with us today. Thank you very much. And I also want to thank folks in the audience too for joining us today. Also, just want to mention that First 5 Alameda County is a public agency, and the information shared today is for educational purposes, and the views expressed today are of the individuals speaking. So again, thank you again, California Immigrant Policy Center, and thank you folks in the audience that has joined us today. We hope to see you next time.